Hallucinogens and stimulants are two categories of drugs that are very different in the way they affect the brain. Hallucinogens alter the user's thought process or mood. This often happens in hallucinations and other visual disturbances like paralysis. Stimulants are chemically the opposite of hallucinogens and are used to stimulate the bodily function in the nervous system and suppress appetite. Hallucinogens are primarily used to get the high or trip. All hallucinogens are illegal because of how dangerous they are. Some popular hallucinogenic drugs are PCP, MDA, MDMA, and THC, but the most popular is LSD. LSD is commonly used in crystal form or dusted into marijuana products. If the drug is administered in high dosages to an unwilling participant, it can act as a date rape drug. Stimulants help people with ADHD. In the 1930s, amphetamine was used to treat narcolepsy, obesity, and fatigue because of its suppressant abilities. Now it is commonly found in weight loss products, but a prescription is needed. Attention deficit hyperactivity disorder is a chronic condition marked by inattention, hyperactivity, and sometimes impulsivity. Amphetamines like Adderall and Vyvanse are commonly prescribed to stimulate and focus the mind. This is very necessary because almost 11% of the population suffer from ADHD. Hallucinogen trips commonly result in synesthesia. Synesthesia is when the person can taste colors and smell sounds. Stimulants have less severe side effects such as irritability, restlessness, hyperactivity, anxiety, excessive speech, and rapid mood swings. Sadness and depression are very common letdowns of the drug too. In the past, LSD was frequently experimented on. In the 1950s, scientists experimented with LSD on children with autism, adults with alcoholism, and terminally ill patients. This was called psychotherapy. A scientist named Albert Hofmann ingested LSD and witnessed a metallic taste, difficulty breathing, dry and constricted throat, cramps, paralysis, and visual disturbances. Testing has also found that pregnant women on LSD can lead to miscarriages because LSD causes uterine muscle contractions. For stimulants, many drugs must be monitored with therapy because they block dopamine and norepinephrine transmitters. This often leads to emotional letdowns and depression. For hallucinogens, the drug prevents the glutamate to attach to its receptor in the brain, and this causes hallucinations. The most traumatizing and long-term consequence of hallucinogens is persistent psychosis. This is when people randomly get reoccurring flashbacks called an echo that are extremely disturbing. Stimulants have a long-term effect called neurochemical imprinting. Because stimulants heighten mood and produce dopamine, the body gets used to the drug doing the work. So once the user stops using the drug, the user will no longer remain happy. And both of these drugs can have many consequences, so they should never be consumed unless prescribed.